Hello and welcome to another episode of the Fully Charged Show podcast. We do live events. I'm sure you know this. And when I was at one of the recent ones in London, at the XL in London, I very briefly met a charming young man and his son who was looking around the show, and we had a brief discussion. And he is a lung specialist. He's a doctor and he's a lung specialist. And he was quite interesting to talk to. Just in that brief time, I registered some anger about air pollution, about the arguments that are used to justify the continued use of fossil fuels. Things like clean diesel and catalytic converters make it pure and it's all, my car is really clean. All those things, all those arguments we've been lied to about by the motoring manufacturers and particularly the oil industry. And so I was really thrilled when I managed to get in touch with him and ask him to come on a podcast. And that's what we're talking about today. Dr. Anant Patel is a lung specialist. That's his main thing that he looks after, and he treats people with serious lung issues at the Royal Free Hospital in London. And he was on duty when he found a gap in his schedule at the hospital when we spoke, which was amazing. And I think I should do a warning, because we do discuss lung cancer. We discuss deaths related to air pollution and to smoking. It's a wide-ranging discussion that covers all those things. So just in case, I don't know if I need to give a trigger warning, but I'm giving one because it's not it's a very informative, fascinating discussion with funny bits, but it is basically dealing with an incredibly serious topic, which is nothing new and nothing special. We've known about this for decades, that the air pollution we live in, and this is kind of why I really wanted to talk to Dr. Patel, because it was the air pollution aspect of electric vehicles that kind of inspired me in the very early days of doing the Fully Charged Show to really cover that. The obvious other aspects of, climate change and all those things, and burning fossil fuels at the levels that we are, don't just affect human beings. They affect everything that's alive on the planet. The planet itself doesn't give a toss. I think it's always, when people would do, we're saving the planet. The planet doesn't care, mate. It doesn't worry about that. The planet's not worried. The planet will still be here when we've all burnt ourselves to a frazzle. The planet will be here for another few billion years without us. The planet's in no trouble at all. We are in trouble, human beings. And that's very specifically what we're talking about today with Dr. Patel. So it is really, I think this is an incredibly important topic. I think we need to cover it more often. I think we need to discuss it more often. There is, as you will discover, talking to someone who has to treat people with terrible, facing really seriously difficult diseases. There is no such thing as clean diesel. AdBlue is a lie. Catalytic converters are a con job. Carbon capture and storage, forget about it until we've stopped burning billions of barrels of fossil fuel every minute that we possibly can. So there is that background aspect to this episode. I really hope you watch it. I really hope you enjoy it and learn something from it. He's an extraordinary doctor. What an amazing privilege it is to have him on the show. So please welcome to the Fully Charged Show, Dr. Anant Patel. Love everything electric? Join us live in Canada this September, the South in October, and Australia and London in 2025. So, Anna, thank you very much this is so exciting for me, because I know you've just been with a patient, you're in the hospital, you're working, and you found a little break. I'm really grateful. But it was so frustrating and exciting to meet you at the live show, to sort of start to hear some of your opinions about air pollution and the effects it has. But would you mind, because most of the viewers and listeners are not going to be in the medical profession, so would you mind doing a super brief, where you trained, why you trained, and why you specialized, and what your specialism is?
Thank you so much, Robert. So really the pleasure's all mine, and thank you so much for having me on. I'm a respiratory physician, so I'm a consultant in lung diseases, essentially. But in particular, my super subspecialty is lung cancer. And over the last number of years, I've been a doctor for 22 years now. And in that time, the number of people that have developed lung cancers that have never smoked has just gone up and up and up. And often these are younger people in their 30s and 40s, people who are more commonly female, people that are more commonly from ethnic minority backgrounds. And this is a trend that we're not just seeing in the UK and in London, but worldwide. And in particular, this is a massive issue in areas of high levels of air pollution, places like Delhi and Beijing and lots of other places around the world, Tehran and others. And so this is something that's been known about for some time, and only last year have we really unraveled some of the major biology that underpins why people are developing lung cancer directly as a result of breathing in air pollution.
And this also, what you're talking about, this is not affecting people in their, like my age, in their 60s, 70s, 80s. This is affecting, I mean, I'm sure it is affecting them as well, but also this is specifically much younger people. I mean, that's really...
Yeah, so this is often really devastating for people who are otherwise completely fit and well, really healthy, have got no other health concerns at all, people in their 30s and 40s. And it used to be once in a blue moon that we saw a patient like that, and we just kind of put it down to bad luck. Now I've got a patient like that every few weeks, and it's really difficult. It's really devastating to kind of help them understand why it's happened to them and what the process is and why it's like that. Lung cancer in particular is a really, sorry to interrupt you, lung cancer in particular is a really horrible disease in that it often presents at late stage, and because when lung cancer is at an early stage, it doesn't cause any symptoms, so it doesn't cause people to go to their doctors and get an X-ray or a CT scan. It's only really when it's grown really big or it's pressing on an airway or a blood vessel or something, or squishing something, that's that
you become aware of it. I mean, my father died of lung cancer due to smoking, so I'm very familiar with it. I mean, he was 75, he wasn't a young man, but it was such an obvious connection, because he was of the wartime generation, and he was actually issued with cigarettes as part of his wages when he was an RAF pilot. So, very, very different time. I mean, that is
extraordinary times.
Yeah. But I mean, it is it was one of my questions, and it is obviously facetious and stupid, but I just wrote down, smoking, is it bad for you? I mean, I kind of know it is. I mean, and I was a smoker, and I gave up in the late 1980s, and still, worry about it to this day. I'm now in my late 60s, and I'm okay as far as I know.
Yeah.
But what a dumb thing to do, and yet that was in the general environment that I lived in then. You barely notice it make a difference because the air was so disgusting, and this was coal. People were still burning coal. The general atmosphere that you were breathing in, even if you didn't smoke, was pretty toxic. So, I mean, I think the point I wanted to make there was, in general, in London, let's stick with London and the UK for the moment, the air quality, I would say, has improved a great deal since when I was born in the 1950s, when it was often referred to as a toxic carcinogenic soup that you breathed.
Absolutely. The pea soup, people used to call it, because the smog was so thick and horrible. Yeah, so there's no question that tobacco is really dreadful in terms of health. Just to put that into context, about 1 in 6 of our population still smoke, and that number's coming down altogether.
Right.
But it's higher in younger people in terms of prevalence, and as people get older, they either give up or, unfortunately, some of them die along the way, and therefore in more elderly populations, the prevalence is lower. But it's still a big number, and unfortunately, tobacco will kill over half of those people. So it's got a lethality rate of more than 50%. So it's still a huge issue, and if I'm honest, that's the thing I spend most of my time when I'm with somebody who smokes. That's what I spend most of my time dealing with, trying to help them to give up smoking. Air pollution is something that affects almost absolutely everybody in the population, all of my patients across in London, and 98% of the UK population. So it's something that's inescapable, but the effect on our health is not nearly as severe as tobacco, but it's still really dreadful. And we can get into some of the weeds of that maybe. And of course, if you've got the combination of bad air pollution and smoking, and that happens unfortunately more commonly in people who have got less disposable income in those kind of socioeconomic groups, actually they're even more at risk. So there's lots of inequality with air pollution and with tobacco as well.
Yeah. But I mean, one of the interesting things that I genuinely had no clue about, which you mentioned, was that this prevalence of this occurring is often in women, is one in women and then of non-Anglo-Saxon background. So, I mean, we're talking, a woman in India or a woman in Accra in a very busy African city, would you expect to see more in that city where the vast majority of the population are African? Would you expect to see more women who don't smoke with lung cancer? I mean, I don't know what the difference is between men and women as regards smoking.
It's really difficult to pick apart some of that information, because In those populations, lots of the male population more predominantly smoke.
With smoke, yeah.
But it's absolutely true that those numbers of younger female patients are going up and up and up over time.
Right. So that, I mean, that's the thing, is how, because when we spoke very briefly, you were very clear that, tailpipe emissions, as they're benignly called, are a problem for us. I had a really literally just now, I was following a tractor. I live in a rural area. I was following a tractor. I was driving an electric car. The windows were open because it was nice and sunny. And I suddenly got, a really big dose of diesel came through the window from a tractor. There's no attempt at making a tractor burn clean diesel or add blue or anything. But you just get that reminder of, my God, this is a really strong gas that's coming out of this machine that I can smell and taste.
Yeah, really horrible. And you mentioned earlier the kind of toxic soup in the 1950s that people faced. And that is a combination of particles that are really thick and really heavy and that just hang in the air. And then we can, with our human senses, detect them. The problem is, the really insidious thing is that the way fossil fuels are burned these days, generally more efficiently over the years, but it means that the particles that come out of tailpipes are smaller. And so what people talk about, this PM10 and PM2.5, is really, really tiny particles. And then we've got ultrafine particles that are even smaller, PM0.1s and others. But the smaller the particle, the less likely we are to detect them and the less kind of evasive action that we can take. You wouldn't spend your whole day behind that diesel tractor. You'd take evasive action. The problem is with these much smaller particles is that we cannot detect them. So even if we think we're kind of finely tuned to the environment around us, unfortunately, with these really tiny particles. So just to give you to give the listeners and the viewers a bit of context, the width of a human hair is about 20 to 100 micrometers across. And so we're talking something that's a fraction of the width of a human hair, really, really tiny stuff. Yeah. And the finer those particles are, the deeper they get into our lungs and the more easily they can get transmitted across into our bloodstream. And the evidence shows us that these kind of really fine, ultrafine particles get into every single cell of our bodies. In pregnant women, it crosses the placenta into the fetus. It causes all manner of issues in really every organ system that we can think of.
Yeah. And I mean, I suppose the thing, I think that the general consensus with our listeners on this show would be that, burning oil in the combustion engine is going to be, is a problem. I think that's a sort of, a foregone conclusion. But I think the amount of people I've spoken to, and I mean, in particular recently, I'm just going to wait. Yeah. In particular, recently, I spoke to a couple of university-educated, well-informed, middle-class people who were very proud that they had what they called a blue diesel car because that's cleaner. And so you go, wait a minute, hang on, because this isn't some, I don't know. This isn't. They were bright people. They're clever.
Yeah.
Well, one of them's a professor. So the delusion that's I think the key thing I could tell you were upset about, and it's that clever marketing of clean diesel, of catalytic converters make your car really, and I don't buy any of it.
No, I completely agree with you. And the misuse of the word clean is to blame here, and the industries that kind of back up the misinformation that you and Quentin Wilson and your whole team kind of work on is extraordinary and really far-reaching and deep-reaching into people that you think just wouldn't be amenable to believing some of the nonsense that's spouted. But it's true. Similarly, when I talk to patients about air pollution and some of the risks that they might face and what they can do to cut down their own risks and cut down risks for the people around them, is a really heavy level of misinformation embedded in their thought processes already. It's really difficult sometimes to unravel that. Yeah. So often what I do is I ask them, where did you get that information from? And then they'll say, Facebook or some other social media site or some other. Yeah. And so I'll ask them, actually, use my computer, log in, show me the page, and we'll just go through it and I kind of debunk it with them one by one. There's lots of that. Wow. There's lots of, there's not lots of time to do that in general clinics, but sometimes if it's an important issue to deal with, for example, if patients are misinformed about, what works and what doesn't work for cancer, for example, there's a big kind of theory in the population that sugar drives cancer and therefore people cut out all sugar. Actually, that makes no difference whatsoever. Right. And so, you take patients into their own kind of sources of information with them one by one in a non-judgmental way, because actually they're a victim of this. They're not the perpetrators.
Yes.
And so the thing to do is to kind of debunk it all one by one as best you can.
Yeah, because actually that was an aspect I hadn't considered before talking to you, is the amount of research that an individual with zero medical training, and I put research in massive inverted commas, into, the amount of people that will inform who've never studied medicine, but still sound like, they'll come up with amazing, that whole world.
And unfortunately, there are some unscrupulous. Oh, sorry. And unfortunately, there's some really either unscrupulous or really poorly informed healthcare professionals that come up with some nonsense from time to time as well. And it's more difficult to debunk that, but actually it's really even more important to do that and then challenge these people directly.
Yeah. But that is, I can't even imagine your job of, meeting a young, let's say a 34-year-old woman who lives in London, from an Afro-Caribbean background maybe, or an Indian background, and then informing her that she's got lung cancer and she's never smoked and she does yoga and she's, or goes jogging or whatever. That's got to be the most really tough job to do, apart from the fact, obviously, for her, it's a horrible experience. But
yeah, it's really horrible for them, exactly. And so for the most part, when I got used to doing that on a day-to-day basis, just generally with smokers, so I got used to that philosophy in my own head. Actually, I didn't cause this. Right. This is not my doing. I'm here to inform the patient, be super honest with them, be on their side, and really give them the best of care and the best of treatment that they can possibly get. And so I kind of carried that over into this other population that's emerging that we've been talking about. But the difference is here that actually it is partly my fault. And I'm part of the system. I heard you on a previous podcast saying, if you think you're not contributing to this, you're not thinking about the diesel trucks that deliver your lettuce to your supermarket.
Exactly.
So we're all responsible in some way, shape or form, and we've all got a responsibility to minimize our own impact. So I guess I come at it from that angle, understanding that I ought to, as an individual, ought to do everything I can, encourage my organizations that I belong to do everything they can, and then essentially spread the word. And this really came and hit me really hard. And I'm sure and you've probably met Rosamond Adu Kissi-Debrah.
Yes, I haven't met her, but I know, very clearly who she is. Yeah.
Yeah. So if any of your viewers or listeners are not familiar with this story, Ella was Rosamond's daughter, and unfortunately she died in 2013, aged 9. She was the first person in recorded history to have air pollution listed as a cause of her death. Yeah. And so she died having had a couple of years of really severe asthma, in and out of hospital a lot, in intensive care. And imagine what that's like for a small child. Yeah. Really bubbly, really lovely girl by all accounts. So if people are not familiar with that, then maybe do kind of have a search about her story, because it's really quite moving. Yeah. And I felt that really deeply, because actually I was driving my petrol car along the South Circular past her house on my way to work and back, thinking that I'm doing a good job here providing healthcare to people. But actually I was part of the problem, and part of that kind of drives me on to try and help people understand what they can do to minimize the issues.
Yeah, no, that is critically important, isn't it? Because it's such a different approach, because, it was extraordinarily obvious to me when I was smoking that it was bad for me. No one needed to tell me. I could tell. I could tell by the way my body reacted to it. It is bad for me. I'm not, no one was lying to try and trick me out of something or anything. It was seriously bad. And it was a horrible process to go through to give up. I found it, I was addicted to nicotine. It wasn't, I didn't just, I'll be sensible, I'll stop. I went through a really miserable couple of months after I stopped smoking. It was a battle, and so easy to start smoking again. I'd given up, and, I'd stopped and started for probably years before that.
Yeah.
And once you finally shed it, and now I don't wake up thinking, I want a Marlboro Red. But, there were some years when I did, without question. But it's such a relief not to have that. But the difference between that, which is in a sense a very personal decision that you've made, and as you say, if you've got someone who's come in who's chain smoked for 40 years, even if you never say it or imply it in your look or anything, there's a kind of background. You kind of did it to yourself. It was your choice to do in that sense. Well, but whereas air pollution is so different, it's such a different world, isn't it?
It is different, but I'll come back to something you said earlier, which is that even in people who have smoked, they grew up in a really tobaccogenic environment, in an environment where tobacco advertising was everywhere, where it was really easy, it was quite cheap to buy cigarettes. The world is different now, and kids growing up in this next generation will have more information and more choice. But people in your generation, actually, even I was born in the late 70s, and actually nobody, blinked twice when a small child like me was
then. Yeah. I mean, you could still smoke on an airplane, for instance, on a long-haul flight.
Can you imagine that now?
Easily.
Extraordinary.
Yeah,
extraordinary.
It's unbelievable, isn't it? Yeah. And actually, the first time I flew to New York when I was still a smoker, and I chose to sit in non-smoking because I kind of knew what it would be like, and it was horrendous. the back half of the plane, you couldn't really see it; it was just a haze over it. I mean, the staff that worked there, if they didn't smoke, what a hideous environment they were in. But anyway, that was a long time ago. Yeah. But then the difference now then is it's a huge technological shift in a sense that is needed to make the air in central London smell the same as it does in my garden here. And it's still, I've lived in London for a long time, and still we were in London over the weekend. I came out the other night, and got out of the car here and went. And instantly, even though I've lived here a long time, I went, that is different. When you breathe in, it's a very different feeling. And it is extraordinary how still today, London, I still find London is a pretty smoky place in a way.
Yeah. And so I was just going to say that even though, we're focusing a bit on urban areas and on London in particular, it's really important to acknowledge that people that live in rural areas are still kind of are breathing in air that exceeds the WHO's targets and kind of parameters for what's healthy and safe. So there's no real safe level of air pollution, but they've got parameters in place which they revised down in 2021. But this is to do with not just traffic-related air pollution, but also industrial processes, industrial agriculture in particular. The release of ammonia from slurries and all this kind of stuff, it really does add to the burden.
Because that was a very clear thing. I remember talking to Paul Drayson, who was a scientist and he was a motor racing driver, but very keen on electric vehicles because of childhood asthma. His children had asthma, and in fact, also to give him his due, Grant Shapps. I had to interview Grant Shapps for the BBC a long time ago, and that man is not making it up about electric vehicles and clean air. He has asthma, and he's got 2 children who have asthma, so he's very, very committed to cleaning the air in London, and all those. It was interesting talking to him about that. That was a long time ago, but I suppose the challenge, and it must be difficult for you, is this woman, someone who turns up who has cancer. There's, I suppose I'm trying to find the difference between air pollution and smoking. I mean, the very obvious one is a thing you could have said to that person is stop smoking. Whereas you can't say to someone, don't live in air pollution, because we all do. That's to get rid of air pollution is a massive problem.
Agreed. And a much more difficult problem to avoid altogether. That's definitely true. The reason I get my smoking patients with lung cancer to give up is because all the treatments work better when they give up smoking. It's nothing to do with what happened before or what caused it, but it means that their outcomes are globally better. The same is true if you can minimize your air pollution exposure. And there are a few ways of doing that. And I don't know really on a scientific level how well this works, but it's definitely worth trying, in my view, of minimizing your own individual exposure to air pollution. So I've got a number of patients, for example, who've got indoor wood burners. And so, I spend quite a lot of time trying to persuade people not to use them, because actually the indoor particulate exposure you get from that is really extraordinary.
Sorry, really indoor. Impactful. Sorry, I didn't catch the indoor, but the indoor what?
Wood burners. You know, these kind of wood burners indoors that look really nice, make the place feel really homely, but actually are really dreadful for people's health. And when I talk about health, I don't mean just lung health, but cardiovascular health, cognitive health, all of these other things as well. So even if it looks like it's well sealed and ventilated well and all this kind of stuff, all the research shows that actually what you're putting out into the outside world is really toxic, but actually what's indoors is also really toxic. Right. Minimizing cooking fumes, for example, minimizing.
Yeah. And that is also a very key difference between when I lived in London, and here I'm surrounded by wood-burning stoves in the village. You can really smell it. I am so aware of it now. And I mean, in the winter when you come back here, there's often a kind of, if it's not a windy day, there's a kind of little cloud sort of just above head height of wood smoke. And, there's a kind of romantic, it smells like wood smoke and it's the olden days, and all that stuff. But but it's got horrible well, I think you tell me, but the particulates are not good for you then that come off wood smoke.
Yeah, I'm afraid to say that's exactly right. So the particulate exposure is really quite harmful,
Right.
and difficult to persuade people that actually you might be better off not using that. There's a few other things that we can think about. For example, walking further away from the roadside, from walking next to a building compared to walking at the curbside makes a difference in particulate exposure. Right. Taking a different route, if you're walking somewhere or cycling somewhere, that you can take a different route that's away from air pollution. That's a reasonably good way of doing that. So there's ways and means of doing these things, and there's lots of obviously websites to help you do this kind of activity. When you're in traffic in an urban environment, the design genius of cars is that the air intake is right at the front, right next to the exhaust and tailpipe emissions of the car in front of you. I mean, It's completely bananas, but there you are breathing in everything. So if you just keep a couple of meters of distance and can see a bit of the road tarmac in front of your car, that's a bit less exposure coming directly into your vehicle, allows that air pollution to dissipate a bit more. And then in particular with kids, if you can keep kids at kind of head or shoulder height compared to an adult, their exposure to particulates is much higher, closer to the ground. If you're 3 or 4 years old, you're right in the firing line. If you're at pram height, you're right in the firing line, and it's horrible. So when I walk along, when I walk along the street, I put my toddler on my shoulders whenever I can.
Right. That is really interesting, because that was a thing I learned many years ago when I interviewed postgrad students at the University of London who've got an air monitoring unit on what I call the Euston Road, near Madame Tussauds, that part of London, which they was telling me is the second most toxic road in Europe. There's apparently a big busy road in Athens that's worse, which is pretty shameful. Yeah. But they said, look, at the height you are, an adult, it's bad. But it was one of their students put one of their air quality monitors down low at sort of children's head height. And that's where the term toxic carcinogenic soup I first heard. He said it's the most lethal concoction down there. And they hadn't thought of it. So this is where this research would have been widely distributed, I'm sure. But I had no idea. And I've pushed my kids along that road on many occasions in pushchairs without a second thought, just horrendous.
Yeah. So this kind of evidence is not routinely taught in medical or nursing school or for other healthcare professional groups. In fact, it's quite poorly taught, and it's something that that we need to do much more about, and to kind of spread the word. One of the major lessons after Ella's death was that the coroner suggested actually that medical and healthcare professional bodies really need to educate their workforces much more deeply about this particular issue. That's one of because she was in and out of hospital for a couple of years, and not one person brought up the issue of air pollution to her or her mum. And so it's really really important that we as medical professionals really do that.
Yeah. And I mean, it is fascinating that because we've all grown up with it. I mean, this is, in a way, my argument that it's normal. It's in a sense like smoking was normal. Everyone I saw, all the adults I saw when I was a kid was smoking. So it was normal. And now driving a car is normal. I mean, loads of people do it. And then and that challenge to go, well, you've got to think about that and maybe not drive a car as much, or not drive a petrol or diesel car. And then you hear that hybrid argument, you go, look, it's a petrol car. I know it might use a bit less petrol, but when the engine's running, what's it doing? It's burning fuel and leaving particulates, emissions.
Absolutely.
Really,
so when I talk to my friends and patients about this, I try and get rid of the word normal. I make the word common. It's really common to drive a car, that's true.
Yes,
but it's not normal.
Yeah. No. But then do you, is there this is an interesting area then. There isn't then wide discussion in in your area of medicine about air pollution. Surely there must be. That's got to be a pretty hot topic.
It's becoming more and more of a hot topic, as you say, and it's becoming something that more and more people are aware of, and actually patients ask us about from time to time. lots of healthcare professionals feel really ill-equipped and ill-trained to be able to answer those questions and deal with it, and they often kind of swerve them. And that's really difficult because we're used to, as healthcare professionals, knowing our stuff and knowing what we're talking about. And when it comes to this, lots of people feel that they haven't quite got the knowledge. So I spend as much of my time as I can teaching different groups of students and postgrads and full-on professionals all about this stuff.
Right. Oh, so you actually would talk to, I don't know how hospitals work, but if there were students, so there's medical students training to be doctors that you would give a talk to about this sort of area.
Yeah, absolutely. So I think, and as kind of webinars become more easily accessible and became the norm during the pandemic, this is exactly what I was talking about to groups of GPs, to medical students, to all sorts of people who are often hearing about this really for the very first time from a fellow healthcare professional.
Right. And actually, let's just touch on the pandemic a bit, because that presumably involved you very, very directly, because it was a lung-related virus, wasn't it? I mean, that must have been truly there were friends of mine who had worked in medicine. So a very old friend of mine was I don't know, she started out as a nurse and worked up the system. I can't remember she was, a sort of war sister and matron, but she went back into intensive care, which she hadn't done for like 30 years because she had to. And it was really upsetting talking to her after that. I mean, she was, and she's a hardened medical professional. She's not like, she's my age. She's been doing it for years. But it sounded horrendous. But then was there a link then with, I mean, I don't even know, but say you had early stage lung cancer and then you got COVID, where your chances reduced because of that, or you had lung related issues?
Yeah, in the sense that it might delay diagnostics and delay treatment if you were sick with COVID. That's true. If you had it in a mild way, it didn't make too much of a difference because you'd bounce back quickly and we can get on with things. We generally protected lots of cancer services as best we could. Obviously, things were impacted in some way, shape or form. There were fewer staff many of whom were off sick themselves.
Yeah.
But you're right. I mean, it was an absolutely horrific time for all of us, population, the healthcare professional, everyone. I mean, it was just dreadful and completely unprecedented. Yeah. And I'm sorry to say, I think it's going to happen again at some stage, because these pandemics are becoming more common and more frequent over time. So we do need to steel ourselves for anything that happens next and think about how we best prepare ourselves in that way. Yeah. It was really mainly horrific because, I mean, as a lung cancer doctor, I'm really used to delivering bad news and being really honest with people about how dreadful the situation might be. But what I found really tough was guiding my team through that. So lots of my team members were not used to having that. And so we'd finish a ward round of 28, 30 patients. And at the end of that ward round, 6 of the patients might have died. I mean, at the height of things, that's how bad things were. It was absolutely horrific. Yeah. And so that's incredibly unusual. And, speaking to even more senior colleagues than me were just, had to a person had said there was nothing like this in the past. This was just the worst they'd seen.
Yeah. But I mean, the bizarrely flip side of it, and I never experienced it personally, but my mates of mine who would send me photographs, they'd walk through the centre of London and go, "You won't believe what this is like." I mean, I wish I had seen it, but there are also so many people commented on how nice the air smelled. A lot of my friends said it smells like when we're at your house.
Yeah.
And I'm in the middle of Battersea, or I'm in Hackney or somewhere. That was so. That was it shows that something. If we did change things, it would make a difference. I think
definitely. And so we knew that with that better air quality during lockdowns, there were fewer heart attacks, there were fewer strokes, there were fewer admissions for asthma exacerbations. There might be confounding factors to some of these things, but I'm sure some of that is definitely related to that reduction in air pollution. That was found across Europe. So thousands of people didn't die during the pandemic because they weren't having their heart attacks and strokes.
That is extraordinary. That is extraordinary. Wow. I've not heard that before, but yeah.
There was some really interesting American data showing that in areas of counties in America that had the highest levels of air pollution, people had a higher chance of dying of COVID.
Right.
And then a really kind of linear pattern to that. So the places that were least polluted compared to the places that were most polluted, trying to link those two things together was really powerful.
Yeah. And I mean, that was where I first became aware of, the painfully obvious facts around traffic, combustion engine caused air pollution was in Los Angeles in the 1980s, which is what really, in a way, spurned the entire transition or the development of electric vehicles. I mean, that's where that came out of. And there was, I remember reading a report when I lived in Los Angeles of the IQs of children who were at a school right next to like a 10-lane freeway that was up high. And of course, now we know that the gases and the particulates would have flowed off that freeway ramp and down onto the school. I mean, it was horrific, but their IQs were really measurably lower than the kids in cleaner air, a school with cleaner air. That was just a shocking thing. I mean, but it's a huge, I mean, that's what I find interesting is that it is a big challenge, but the things like the ULEZ and electric buses, already I've read a couple of reports recently have actually made a difference, that there's less diesel buses on the road and there's more electric ones. And it's only a slight difference, but it's heading in the right direction. It is getting better.
I think it's a really significant difference already. I completely agree.
Right.
Of that improvement in air quality is measured really really carefully, and actually the evidence is very clear that there's so much less air pollution as a result of some of these policy measures.
Right.
Right. What hopefully will come a bit further down the line is what are the kind of knock-on health benefits of having better air quality and tying the policies to health outcomes. And I think that evidence is coming, it's emerging, but obviously these things take a bit of time to kind of filter through and to measure. The things that we can measure really quickly are things like admissions for asthma in children, admissions for heart disease, for heart attacks and strokes. Definitely all of those have come down with better air quality. But the things like that are more of a slow burn development of lung cancer, development of worsening lung diseases like bronchitis and emphysema, that will take a much longer time to find out about in dedicated data.
Yeah. God, it's can we now just quickly? I mean, these questions are now pretty much pointless, but I want to hammer the point home. Is there such a thing as clean diesel? That's such a stupid question.
There is no such thing as clean diesel, and I teach my son to call it diesel.
Diesel, yeah. Yes, very good. And what about? And I mean, presumably, though, some of the. I mean, I'm going to give the fossil fuel industry the benefit of the doubt, but and the automotive manufacturers. But the things like a catalytic converter, if you've got a catalytic converter that's working and clean and new, presumably that's better than a 1967 Vauxhall Victor with an exhaust pipe and a silencer and nothing else. I mean, have some of the technological advances in cleaning up combustion engines, are they better?
I think that's definitely true. That's definitely true, but it doesn't take away from the fact that as vehicles get older and people have them for longer and drive them and look after them, actually they become less efficient over time. The engines become less efficient and the catalytic converters work much less efficiently. And so even if you kind of test these things truthfully in a lab, and we know that that's not always been the case, that these things have been tested in a truthful way, that even when we do test them truthfully, that's not the reality of the lifetime of that vehicle and what it's doing to the urban environment. And so we have to take that into account. Actually, what's the kind of life cycle of these products rather than actually a lab test at the beginning of their life cycle?
Right. Yes. Which we know has been very dubious. And I mean, it is the other argument. I'm just that has been it comes and goes with electric vehicles is tire and brake particulates coming off vehicles, which is one of the we recorded a show and an interview with a company that measures tire particulates from electric vehicles, and the research. You would have to be a 5-year-old to not go, hang on a minute, some of this research is questionable. I mean, it was really shockingly bad. They used a diesel car with bricks in the back to recreate what a petrol car was like, and then they had a scoop behind one of the wheels, and anything that scoop caught, they said, came off the tires of the vehicle. Well, you ride a bike when you're a kid through some mud, and you see that other stuff gets thrown up that didn't come off the tire. It's just like, for goodness sake. But presumably, I mean, there's so many vehicles on the road. If your tires wear down, that stuff that's gone off your tires, the tread that's gone, has gone somewhere. So, clearly it is a problem. But, but I suppose the question is, are those particulates bigger? They're going to be bigger, I would assume, than PM 2.5s. I mean, that is tiny, tiny.
I don't think I've seen any good evidence about the size of particulate exposure from tyres. I don't know that for sure.
Right.
I think the chief medical officer did a big report into air pollution in 2022. And one of his key recommendations was innovations in material science to make sure that whatever we're using for tyres basically doesn't throw anything off. Because even if they are bigger and don't get into our bodies, that we don't breathe them in, actually the microplastics in the environment from tyre wear is an issue. But that's an issue across all vehicles, altogether. That's not just EVs or just diesel vehicles. It's all vehicles altogether, and that's definitely something that everyone needs to work on. But it's very much a drop in the ocean when we compare it to traffic-related tailpipe emissions.
Yes, yeah,
which is very much the big beast. Yeah.
Yes, and I'm assuming, although I haven't asked, that you don't drive a petrol or diesel car now.
Correct. Yeah. So first got a Leaf in 2018, and then a Model 3 in 2019. So we are attempting to be as ecologically friendly as we can, understanding that actually everybody and everything has an impact, but doing our best to minimize that as a family.
Yeah. Yeah. And then, hang on, I've had a log jam now because I had all these other questions. No, it's gone. That's embarrassing.
Could you imagine if I turned around and said, no, I'd drive a big diesel SUV at the end of all that?
Yes, I know what I wanted to ask. I've just remembered. Thank you. No, absolutely. That would be great. Anyway, no, I kind of knew you didn't. But then there was a story recently. I think this is really fascinating how these stories go. A story recently about Alderhay Children's Hospital in Liverpool, where a guy in an electric car, and he couldn't. Then you find out the detail, because I never react to those stories, but you find out the detail, and he was parking it. There was a car park underneath the hospital, so underneath the wards with sick children in, and he wasn't allowed to park it there in case it caught fire. And you go, So then I said they were right to ban that car. It should not be allowed to park there, nor should any diesel or petrol or hybrid cars, because they catch fire more often, caused a huge uproar. And
way more often.
Yeah. Yes. Yeah. Way more often. And also that what wasn't in that story was that Alderhay multi-story car park that's separate from the buildings of the thing has loads of electric car chargers in.
Yeah, so many mixed messages in this story.
Yeah.
I think they got that advice from their local fire service, is what I'd read.
Yes,
and I find that really difficult to stomach, because it's just based on opinion and not fact.
Yes, yeah. I mean, we have a wonderful interview, one of our podcasts, and we've had her on stage in Australia. She's an Australian fire officer, and guess what? She drives an electric car because she attended, I think, 1,800 and something car fires in her career. And one of them was electric. It's that kind of level. And she said the amount of pickup trucks that aren't well maintained, and then there's a spark and something happens and they go up in flames, and very often no one hurt. You've got time to get out of the car. Yeah. But the amount of those they have to deal with is off the scale, off the charts, But yes, that was a particularly difficult thing. The other aspect which we should mention is public transport, cycling, walking. Quite good ways of getting around, particularly cities. I mean,
and I know you've made this point. You've made this point repeatedly that converting every fossil fuel car into an electric car is not the solution here. The solution is much more to encourage people to travel actively, to walk, to cycle, to get on a scooter, whatever it might be that doesn't cause any emissions at all and actually does them lots of personal health benefits. So that's definitely true. I saw some data showing that if you were a cyclist in London, the benefits of the exercise you get outweighs the risk of the air pollution that you're breathing in those kind of congested areas, and it outweighs it something like 10 to 1. So really, really powerful. To stay physically active is incredibly important.
Right. That is because the one period of my life when I was about in my mid-20s, when my showbiz career bit the dust, and I became a cyclist courier at the height of cyclist courierism. And I think I was like 26, but my call sign name was Grandad, because the average age of the couriers was like 17 to 20. So I was old, but I cycled an average of 65 miles a day around central London, at speed, because you had to. It was always a rush job, and I just thought this is going to kill me. This is what I'm breathing in all day. But, I was incredibly fit because I was just going like the clappers all the time. And incredibly lucky not to be knocked off by a truck or a bus. I escaped with a few bruises, but nothing more than that. But that is very interesting. I didn't know that. So actually, maybe I should. But also, at the same time, when I did stop and get off the bike and I delivered the thing, I then have a cigarette. Just
different times, Robert. Different times.
I'm so ashamed to tell you that. It's just terrible.
No, not at all. Not at all. I'll just follow on from that. If in 1 or 2 generations of people, tobacco's gone from this thing that was quite common and as you said before, normal, to now it's everybody knows it's just the worst thing that you can do for your personal health. I hope the same kind of philosophical process can happen in people's heads about air pollution, that this is something that we all need to do something about and actually minimize our both our kind of creation of and exposure to.
Yeah, I think you're absolutely right. I mean, that's what I've been sort of slowly trying to head towards with people when I'm talking to people about, because my latest approach has been, I don't want to talk about electric cars or, the benefits or the problems or all that and the charging infrastructure and the batteries. Yes, I'm not interested. Is what we do now okay? That's the question. Is burning, and it is billions of barrels of toxic fuel.
Yeah.
And people say, oh no, my car's really clean. And I know it's a really bad suggestion to say, sit in your car for 10 minutes with a hose pipe coming off the exhaust into the car with the windows shut. It's not, we shouldn't advise people to, or even suggest that, but it's not clean. That's the real frustration is that.
Completely agree. Completely agree.
Yeah. I'm so happy that we've had this chance to talk, even though it's been a bit glitchy. I know it's been a bit difficult, but it's been really good. I would love to get you to, if we can arrange it, to come to one of our live shows and do a panel talk there.
I'd love to.
Really good. Yeah. But it has been really, really good talking to you, Anant. Thank you so much. And I'm worried that you've got patients waiting for you.
Don't worry, I've organised them before and after. It's all sorted out. Yeah,
but it's been fascinating talking to you. And there's so many. Just briefly, because we can trim around this. Is there a particular point that you would like to make, or have we kind of covered most of the basics?
I think we've kind of covered most of the basics. I can't. No, I don't have any other overarching message other than that.
Right.
And to say thank you to you and your whole team for what you do. A big part of me kind of moving into electric vehicles was because of you guys. Reason why I attended the event where we met briefly was because I was trying to decarbonize my home heating, which is proving very difficult to do, but that's another issue altogether.
It's not easy. Yeah, that's another huge thing. That's also another thing we could discuss. If you think of, I don't know how many homes would have a gas boiler in London, but it's in the millions.
Yeah.
And they're all burning gas, and that gas, the particulates from that burning that gas are going out into the atmosphere. It is, huge.
Yeah.
So on that very bright and optimistic note, sorry about that. I was trying to think of something jolly to say at the end, but that's been no. But anyway, thank you so much for.
I'll say something a bit jolly.
Yeah.
I'll say something a bit jolly at the end if you don't mind. Yeah. When I bought my car before these electric ones, the dealers were really heavily pushing me towards a diesel car. This is mid 2000s. Right. And I was really thinking about it, and it did not occur to me one iota that it was so much worse than petrol at that time. I was a qualified doctor at the time, thinking of going into respiratory medicine, but didn't really understand any of this stuff. But within and I think like loads, I can't remember the percentages, but loads of those cars sold in mid 2000s were diesel, and actually within a generation, people have generally got rid of them. And so I think the same thing will happen, and you guys are really at the forefront of making that happen. So thank you and well done.
I think it's hard to say. I really hope you enjoyed that. I really hope you got something from it. I certainly did from talking to Anant, and he's such a lovely guy, and so just an amazing human being. And what a difficult job he has. And I think if those of us outside the medical profession just cannot imagine how you do that day in, day out for years. 20 years he's been doing it. So hats off to him. Hopefully we will see more of Dr. Anant on the show and at live events. That's certainly one of the things we're talking about. So please do tell your friends, in particularly the ones who might argue that their new diesel car with AdBlue is clean. I mean, that the couple I heard about that did that, it's just heartbreaking. Because, yes, you can say, so that particular couple I mentioned there, it wasn't that they bought a third-hand diesel car, which I totally understand. Who can afford to buy a new car? No, they bought a new car. They made the decision to buy a brand new car in 2024, a diesel. That is just beyond comprehension. No more ranting from me. That's all. Please do have a look at our webpage, which explains has all the details of all our live shows, which is at fullycharged.show. Not hard to find. So do tell your friends about this, particularly the ones who want to carry on burning diesel. Do subscribe if you haven't subscribed, because that is brilliant. That our subscriptions do help us. We've got over 1 million subscribers on the Fully Charged Show. We need to get to 100,000 on the Everything Electric Show. That's our target. It's not our target. No one talks about it. I do. I think it's our target. That's it, as always. If you have been, thank you for listening and watching.